You are coming to the end of your FI1 year and are feeling much more confident about your abilities. You meet a non-medical friend for lunch on one of your days off, and they tell you that they are worried about a mole on their shoulder that seems to have changed in appearance. They ask you to take a quick look at it and advise them on what to do. They show you the lesion, and you feel that it looks very normal with no worrying features. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Offer to take a picture of the mole and show it to a more senior doctor at work. B. Reassure your friend that the mole looks absolutely fine. C. Reassure your friend that the mole looks fine, but suggest that they show it to you again in a few weeks so that you can check for any change in appearance. D. Say that the mole doesn't look too worrying to you but that you would recommend they showed it to their GP anyway. E. Tell your friend that you really cannot give them advice, and they should go and see their GP promptly. Answer: E, D, A, C, B. If you give advice to your friend, you are accepting a duty of care towards them, which makes you responsible for any investigation or treatment that could be indicated. You should not make the decision that the mole is benign, B, as you are very vulnerable to both ethical and legal criticism, particularly if this is incorrect. Reassuring your friend that their lesion does not appear worrying and asking to re-examine further down the line, C, is a slightly better response because you are making an attempt to further evaluate the mole rather than simply making a one-off assessment. However, this still leaves the duty of care entirely with you. Although it is inappropriate to informally get an opinion from one of your seniors, A, and this colleague would probably be unwilling to be involved if they realized what you were doing, at least you would be trying to ensure that you are not the only professional who has seen the lesion. The best approach is to encourage your friend to see their own GP, options D and E, thus declining to have a duty of care towards them. It is safest not to give any opinion, E, as, if you reassure your friend, this may make them less likely to subsequently make an appointment to see their GP. You are the FI1 in gastroenterology. Halfway through the morning ward round, your consultant is called away to see an acutely unwell patient. As he leaves, he asks you to consent the next patient for an OGD, esophagogastroduodenoscopy, which is happening later that day. You have never done this before and have only seen the procedure being performed once as an undergraduate. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Access the intranet for local guidelines on consenting patients for OGDs and familiarize yourself with these before proceeding to consent the patient. B. Call your specialist registrar, SPR, who has performed the procedure before and ask them to consent the patient. C. Chat to the nurses while waiting for your consultant to return, as you have never consented for an OGD and should therefore let him do this. D. Explain what you can remember about an OGD with the help of your Oxford Handbook of Clinical Medicine, telling the patient that you will find out later about the risks and benefits, then proceed to consent them. E. Print out an information sheet from the internet for the patient to read. Answer: A, B, E, D, C. This question highlights the importance of taking informed consent. General Medical Council, GMC, guidance states that you should only gain consent for procedures that you have either been trained to perform or that you have been trained to consent for. However, as there are local guidelines available for consenting and your consultant is unavailable, in this situation, it would be appropriate for you to consent the patient in your consultant's absence. A. Patient information leaflets can certainly be a useful aid to verbal explanations but should not be used as a substitute. E. For this reason, asking your SPR to help may be more suitable. B. While using information from a textbook can be useful. D. It is unlikely to have all the necessary information or be as up to date as local policies on the intranet. You should explain the risks and benefits of any procedure when gaining consent, and if you are unable to do this, you should endeavor to find out the information before the patient consents. It would therefore be inappropriate for the patient to sign his name before being fully informed. Obtaining consent is a requirement for any procedure, but in this particular case, it should be written and completed in a timely manner. Option C is therefore the least appropriate response, as you are not being proactive in completing the task that may consequently delay investigation and future treatment.